in menopause, we've got this amazing transition of our, epigenetics to empower us in the right environment. So we can, guess what, create our environment.
Let's talk about perimenopause. We've been sort of leading up to it and talking about it really throughout this conversation. But how does fasting change in perimenopause and then maybe in our menopausal years as well?
I think the way we enter perimenopause is a litmus test of how well we're taking care of ourselves. And I couldn't have said that 10 years ago because I didn't know any better, but now I do. And so I think it's really the time we have to level up self-care. It's the time we have to level up taking care of ourselves, because if we don't, we will have more problems, symptoms transitioning from the 5 to 10 years preceding menopause, which is what perimenopause is. And so this is when I get really specific about stress management, sleep quality, anti-inflammatory nutrition. I get very specific about types of exercise. Because if we optimize those things and if we lean into where we are in our cycle, we are going to do much better. And then the eating less often piece can oftentimes be like the missing link, because I had done all the other things. It was the eating less often piece was the last thing in perimenopause that made the biggest difference. So I think when we start to understand what's happening in our bodies in terms of sleep, as our ovaries are producing less progesterone heading into perimenopause, this may manifest as anxiety and depression. It can manifest as sleep disturbances. We have to ratchet in on that. And it doesn't necessarily mean that every person has to take medication, but it could be that it may be that you lean into specific types of foods, that you have to have a better sleep hygiene. Like I think about sleep when I get up in the morning, like I'm already preparing my body. Maybe it's removing inflammatory foods. And I'm sure your listeners know that those are things like gluten and grains and dairy, depending on who you are. It could be alcohol. Alcohol seems to be one of those like big elusive things that we know in perimenopause can really dysregulate melatonin secretion, increase cortisol. It can impact sleep quality, can ultimately impact blood sugar. And Lord knows, when I used to drink alcohol, which I don't anymore, and I never had a problem. I just gave it up because it impacted my sleep so negatively. I never made good food choices. It was unfortunate, but it was like I wouldn't crave the really good food. I'd end up craving the stuff I shouldn't be eating. And then thinking about timing of your exercise for where you are in your cycle. And hopefully in the beginning of perimenopause, your cycles are still pretty regular. So you're able to determine like where that follicular phase is, where the luteal phase is, leaning into acknowledging that there are certain times during the month when we can push the lever on fasting and times when we should back off on it. And so I find for many women, if they're tuned into those key areas, that period before they go into menopause, 12 months without a menstrual cycle, is pretty benign. Those are women that have better balanced blood sugar, their fasting insulin levels are lower, their inflammatory markers are lower, they maintain a healthy weight, they don't have hot flashes. Like I think hot flashes are, and based on research and everything I've read, hot flashes are more often a reflection of blood sugar dysregulation. I think people think about it so much, it's all related to estrogen. And I tell people that that's always like a sign that something is off. And that was one reason why I stopped drinking alcohol. I would get hot flashes. It was like the only time I would get a hot flash. And it was so uncomfortable, even though mine were pretty benign. I was like, goodness, between the sleep and the blood sugar dysregulation related to the alcohol use, I'm like, I can just have my mocktail and, go to parties and just be totally fine. So I think, again, perimenopause is a litmus test for how well we're taking care of ourselves. And especially for women with small children, with children in general, with significant other spouses, we have a tendency to give to everyone and then worry about ourselves last. And this is a time, if you really want to have a healthy, happy middle-aged time period, it's really a time to be reflecting on what you're doing well and to be honest enough with yourself to say, what is no longer serving me? And either replacing it or finding alternatives if it's something that you really enjoy. I'll give you an example. I mean, I've been gluten-free for over 10 years, and that put an autoimmune issue into remission. But one of the things I had to give up because it kept me so inflamed was dairy. And it was a hard decision. I didn't realize how much I liked dairy and how much dairy was a part of my lifestyle until I removed it. And once it was removed, I mean, that perimenopause weight that I could not get rid of went completely away. And it just goes to show you, even like sporadic use of an inflammatory food for your body can have an enormous impact on weight you're carrying on, you're hanging on to. And so for me, I was delighted. My family was like shocked, but I just said, if this is what it takes for me to be healthier, because I could tell I was inflamed because I would sometimes get like ankle pain or foot pain. And so taking dairy out of my diet, but it can get more nuanced than that. I find some women have to remove, some of the plant-based compounds like oxalates and saponins and, other things, but I think, or lectins, but for that matter, it's really determining for you, what do you need to do to help keep your cortisol balanced, to keep your sanity. And the last thing I want to add to that, you are on this incredible platform talking a lot about physical activity and strength training. And so for me, the days of doing like really hardcore conditioning, like almost CrossFit-esque types of workouts were gone. They completely messed with my sleep and did not serve me. I could go lift heavy and I would do fine. And I could do HIIT in short amounts and I could walk, but I had to honor, and I just do more yoga, more yin yoga, really honoring where I was, that those really hard, I'm going to pick on Orange Theory Fitness, but there are women that are doing that 5 or 6 days a week. And they're like, I don't understand why I can't lose weight. And I was like, well, it used to serve us in our 20s and 30s, does not serve us if we're working out that intensely 4 or 5 days a week and wondering why we can't lose weight. And again, it's talking about the cortisol. Cortisol goes up because it thinks you're running a marathon every day. You're going to really struggle. So that's kind of been my, N of a couple thousand, working with women at that stage of life. Like the people that do the best navigating into menopause are the ones that dial in and find appropriate ways to challenge yourself, but not do it in a way that you are overtaxing your adrenals, overtaxing cortisol, dysregulating your sex hormones worse than they already are, as we kind of make that transition where we have less circulating progesterone, a bit more estrogen dominance for most people, maybe faltering testosterone levels, which all impact, every way that we perceive our lives.
And with that, I think is a perfect bridge into what menopause can be like commonly, and maybe how we might think about optimization of menopause. So let's start by maybe pre-framing and even going a little bit, before we jump into menopause. Let's talk a little bit about perimenopause, and what are some of the, I'm in perimenopause right now. I'm in the double fours right now. I'm 44, and so. I haven't experienced, like, of course I've studied it. I've helped, lots of clients with it. And I think that I've done a relatively good job at, preventing some of the common symptoms that we might see occur or that we might have our patients complain about in menopause. And I think that we can talk about this from a hormonal perspective, but you said something really interesting that I thought we might start with the mental and cognitive. First, with the schema that we have, like the belief system that we have around what perimenopause and or menopause might be.
Right.
And then we can maybe talk about some of the brain changes, cognitive changes, and then how those might then begin to influence us skipping the workout or snacking on, whatever, cheesecake or having extra wine or whatever to placate our emotions in the evening. So let's talk a little bit. Let's start with, sort of the brain and the mind, if you will.
Yeah. And you had to mention wine. I'm in the middle of Lent and I gave up wine. So I'm whining, no wine. But, it does also make a difference, certainly, especially as we get older. You said something really I want to emphasize. You said helping, and this makes you different than many other doctors, helping your clients prevent the symptoms, right? Versus I'm treating the symptoms.
Right.
This is completely by design, the way it has to be done. Because when women are coming through perimenopause to their primary care doctor or gynecologist, sometimes their symptoms are just being treated or suppressed and not prevented or addressing the underlying causes. And so often they get a birth control pill and they get an SSRI, and then they get a endometrial ablation or a hysterectomy. And then I will say, then after that, you've given the antidepressant, you've given the birth control. Now you've removed the uterus and ovaries since they're over age 35. What do they need them for anyway? And before you know it, they're getting a referral to psychiatry and a divorce attorney. I mean, it's so true. It's very sad. And I was sitting at a beautiful table of amazing professional women on last week for lunch at an exclusive club here in Dallas. And they, had all hormone questions, right? They're like, oh my gosh. So they were asking all hormone questions. And 3 of the 12 women at the table were on birth control pills, and they were older than 50. Everyone pretty much at the table was older than 50.
I've always found that crazy. How is a 50-year-old on birth control pill?
It's and not for birth control, right? And not for birth control, right? For hormone, that's the treatment of the symptoms, right? Mm-hmm. That's the suppression of the symptoms will come in after, and then, we've got our next best option versus, well, let's empower your body so you're not symptomatic through this transition. And let's not give you an additional endocrine disruptors, such as the synthetic progestins that are in every single one of those birth control pills, sadly. And let's, prevent you from experiencing these symptoms. And until I went through it, I wouldn't have known the severity. And again, that's my specialty. I spent hundreds of thousands of dollars and the prime years of my life studying hormones, hormone cascade, gynecology, reproductive endocrinology, and the list goes on. But to find out that above those hormones, those most important hormones you mentioned at the beginning, our cortisol, our insulin, and the most important hormone of our entire body and our lives, oxytocin. And so in understanding this, getting to those treatments, well, what is happening with what's happening with our physiology in our in our 20s to late 20s, our DHEA, that's a precursor to estrogen, testosterone, is also starting to decline. And then progesterone, our mother hormone, in our mid-30s is really declining. And it declines quite rapidly. And add in 35 to 55, sharp decrease, loss of maybe like 55%, 65% of total production of progesterone during those years. And add in some healthy stress, further plummeting, emptying that progesterone bucket, and you really have a decline in the estrogen and testosterone. And understanding that that's happening and that enters this period, it's, we've called it estrogen dominance, but really neuroendocrine vulnerability. I've got to find a better name, but it's affecting our brain and our hormones, our brain and our body, our nervous system, and our reproductive hormones. And so this transition happening is creating a shift in how we think, how we sleep, how we move when it's not optimized, So by design. And this is where I really discovered when I was in like 48 years old, around 48, this time period, 46 to 48, I was just plummeting. And I had the post-traumatic stress still under the surface. And that was an issue too. And I had brain fog, mood swings, irritability. And of course, cycle was basically non-existent at that point. And I gained 20 pounds without doing anything different. And that's where, when my patients would say that to me, Stephanie, I'd be like, sure, you're not doing anything different. How is that possible? Oh my gosh, you guys, it's possible. And my hormones, my bioidentical hormones were dialed in on the labs. My thyroid was good. My hormones were good. Optimal. And so, okay, so what else is going on here? And that dug me into, really the ketogenic diet and the ketogenic lifestyle. Cause I was like well over 240 pounds at one point, gaining 20 pounds, what felt like overnight without doing anything different. When would the scale stop? So I strictly reduced my carbs, and very quickly it didn't feel good. And I'm very familiar with ketogenic diets and low carb diets because I treat patients with Candida, with chronic yeast infections and seizure disorders, neurologic conditions with keto. And I have a daughter with seizures. So very familiar with the ketogenic lifestyle. But then I started feeling like I hit a wall, and I call it, keto crazy, keto cranky, keto crazy. It just didn't feel good. And I recalled many of my patients in the perimenopause, menopause time period, when I put them on this type of regimen, they said, Dr. Ann, I just don't feel good. And that's what that's where I really dug into understanding, okay, what's happening physiologically? What's going on here? And checking urine pH. I was as acidic as the urine pH paper read. And for me, that was the aha moment that in order to do a keto healthfully as women, we needed to add in the greens and the alkalinizers.
It's great. And, I think that women who are in that drop zone, let's say, like those, that age 46 to 48, we really do underestimate the impact of that chronic, in your case, very acute and then long lasting chronic low grade stress and inflammation. And you described the pathway before where there's sort of this diversion to be able to make cortisol in order to be in that survival mode at the expense of some of our sex hormones like estrogen and testosterone. And just to round out this conversation, I have a lot of patients that will say, I just don't feel like confident anymore. I don't feel like I feel like I'm shrinking. That's a lot. I sort of get that. Like, I don't feel like I'm, putting my best foot forward. I don't feel proud. And when we sort of look at this from a physiological perspective, of course, estrogen, one of the many effects that it has, and I'm oversimplifying this a little bit, but one of the many effects that estrogen has, certainly in the brain in particular, is it bathes our verbal centers. So we are much more articulate. We have, much more colorful vocabulary that we might be able to draw on. And testosterone, of course, does help with our confidence. It's famous for libido, of course. And yes, it's, certainly, intensity of orgasm, sensitivity of the clitoris, like all of that is all true. But in terms of like those brain-based changes, we don't feel as confident. We don't feel like going out to a party, let's say, or going out to it doesn't have to be a party, like a dinner, like you were, or lunching with the ladies, like you were last week. You don't feel like being social. And then you sort of get into this really vicious loop where maybe you're not talking as much as you should be. You're not socializing as much as you should be. And you become more insular and inward and inward. And, we're going to talk a little bit about some of your research in terms of menopause around the world. But one of the things that I think is sorely missing, at least in North American society, post-pandemic, I think we can say post, right? We're beyond the pandemic at this point. Hopefully, we'll see. Post-pandemic is this isolation, right, that we've all experienced, right? This lack of connection and lack of communication, which sort of brings me round to oxytocin, which is something that you're one of the few practitioners that I see talking about consistently. Can you talk a little bit about the impact of oxytocin? You called it sort of the mother, or maybe you didn't, you said the master hormone. You called it the master hormone. Can you talk a little bit about that?
Yeah, the queen, the reigning hormone, right? Absolutely. And it's so important because we're going through this perimenopause time period. And just to emphasize, the reason that keto works so well is because we need, and the benefit of estrogen, it promotes gluconeogenesis in the brain. Our brain will soak up the use of glucose. I mean, it is the primary consumer. So in perimenopause, we're getting the brain fog, all these neurologic symptoms, in addition to the hormonal symptoms, the neurologic symptoms. It's because our brain is starving for fuel, essentially. When we shift from glucose as a primary source to ketones as the primary source, that's not hormone dependent. So that shift brings the clarity, brings the, that's like jet fuel to the brain where glucose is gasoline. And so it's a huge difference. And that's why I say it's not just a good idea in perimenopause and menopause, it's mandatory. It's mandatory. So from 40s on, shifting with metabolic flexibility, right? With some variety. I love my feasting. That's part of celebrating in community too. So with metabolic flexibility, but getting into ketosis a good percentage of the time, over half, if not 80% of the time. And so that shift is essential to breeze through menopause into what the Japanese call the second spring of our lives. And that makes a difference. And in order to do that, we have to become insulin sensitive. So your book, my books, that's what we're driving people towards, insulin sensitivity. And you and I with a similar heritage, certainly me, I feel like I can live for 6 months in the Sahara with no food and water and I will be fine.
Same.
I will be fine. My body is so metabolically conservative. That is by design, but survival genes, right? Survival genes. And that's good. It's another way to look at those otherwise, tagged as fat genes. cancer genes, diabetes genes, heart disease genes. You've got that in your family. Congratulations. You are a warrior. You're a warrior, babe, right? Like, oh my gosh, you're designed to be an Amazonian, a Saharan princess, whatever it may be, but shift the way we think about the things that are family history. Why are we so empowered by these, like the Native Americans, for instance, a perfect example of these diabetes genes? No, you've got warrior genes. I tell my young teenage girls, Pocahontas genes or Mulan genes or whatever their heritage, an ideal that they can focus on or relate to. That's the difference. In menopause, we've got this amazing transition of our, epigenetics to empower us in the right environment. So we can, guess what, create our environment to overpower some of the, technically worse genes. We call them the worst genes, but there are survival genes. We are empowered by those. So there's my argument for that, Stephanie. That's like all reframing, right? All reframing, it makes a difference.
I like that. And I wanted to maybe double click on something that you just said, which of course, you and I being sort of advocates for the ketogenic diet for women. One of the things that I've also heard, and I did this myself. So when I first got into keto, I was like, I'm going to do it like all the boys are doing it. Like, Dom D'Agostino is going to fast for 7 days. I'm going to fast for 7 days. I see Peter Attia doing something. I'm like, I'm going to do what Peter's doing,
Mm-hmm.
And of course, I've had Dom on the podcast, and we've had this discussion around the ketogenic diet and how we should be nuancing it for women. Of course, at the time, I was being bullheaded and stubborn. Make the case for my heritage. You probably might be able to do that. But let's talk a little bit about, and you said metabolic flexibility. I am a really big advocate for, and I know you are too, around this idea of a therapeutic intervention of ketosis, because then you get those ladies that they say when they're 50, they're like, I've been doing it for 6 months and I don't feel good, right? So is there, and I'll ask this, is there a place for, for lack of a better word, keto cycling, protein and carbohydrate cycling? I'd like to talk about it in the context of through the menstrual cycle. But let's expand that a little bit and let's talk about how that might apply to perimenopause and then menopause as well.
Yeah, definitely. And, with my book, Menopause, there are different pauses because as women have been doing now for years, my first book, The Hormone Fix, came out in 2019, but I've been doing my online Magic Menopause program since 2015. And as I've worked with women and we get stuck doing the same thing all the time, right? And it no longer serves us. So we have to change it up. And so these pauses came from that. So following a keto green kind of basis, definitely working with intermittent fasting and no more snacking. All my menus are 2 or 3 meals a day, depending. But each 6-day pause is something different. So keto green extreme is more autoimmune paleo, avoiding nightshades and peppers. And the second one is all plants, avoiding meats. And really, as we know, plant diversity increases microbial diversity in our gut and is really strong resilience. Plus, a lot of people doing keto are very constipated. We cannot have constipation, have good skin and pretty hair and, and be nice. We can't have constipation.
So, and be nice. You can't be constipated and be nice.
You cannot. So remember that. And then we go to a carnivore plan. And so avoiding all vegetables, which have sometimes been hard to digest. And we're giving your system a chance to rest in each of these different pauses. And then there's a cleanse plan, and then there's a carb up plan. Sometimes my ladies have been following my program and not doing any feast days. And I have no problem with that, Stephanie. No problem with missing, feast days are just part of my life. But, I work with women and we have to add carbs back, some sweet potatoes, some root vegetables. We have to up their carb intake. And some women will actually lose weight during that, but they'll feel better, sleep better. And that's an important thing to do too. And I don't want anyone to be, have restriction fatigue or diet fatigued or be stuck doing the same thing every day because Variety is the spice of life. I love that quote. And it's so true. Variety is the spice of life. But just like you can't do the same workout routine every day, you can't feed your body the same thing every day. It will develop food sensitivities, resistance. And we want to keep changing things up to support gut microbial diversity. So that's a really key part. And that supports estrogen metabolism and hormone and neurotransmitter, serotonin production. So we need that healthy, diverse gut. And especially for women, men have 10 times as much testosterone. They can get away with a lot more restriction. They can get away with a lot less alkalinity focus because they have 10 times as much testosterone, which converts to estrogen, which is why they don't get that rapid brain fog memory loss in their andropausal years that we do in our menopausal years. And so they've got that covered. So for us, testosterone is the anabolic steroid, the anabolic hormone that's going to keep their bones, muscles, skin good. For us on ketogenic for a long time, if we're acidic and not paying attention to urine pH, which is the most important biohack or biomarker that I can follow, one of the most important one, as important as your blood pressure, your heart rate, I think even more important, because an alkaline urine pH, especially combined with a ketogenic diet, it is game changing. It is energized enlightenment. You feel clear, you feel grounded, you have peace that surpasses all understanding. And that's that physiologic shift. And that's really important because we know that a higher urine pH is associated with lower uric acid, clearing more uric acid. That's good. Thanks, Dr. David Perlmutter. And associated with decreased cancer, decreased cardiovascular disease, and decreased diabetes.
Well, yeah, I love that, and thank you for name dropping my program. I appreciate that. That is one of the hallmarks of the Estima diet, is that it is a low carbohydrate diet, and it's meant to help correct some of the metabolic, let's say, derangement that we can accrue over time. And what I wanted to ask you, I have young children who do love French fries, and it doesn't really seem to bother them. Is there a difference? Is there sort of an age-related sensitivity? And we were talking about this in the pre-chat. A lot of women listen to the show. And one of the things I say is if you're 45, you can't eat the same way that you maybe did when you were 25. So can you speak a little bit about if there is any age-related sensitivity to this pathway, to this endogenous production?
Yeah, so there's two aspects, and one is specific to women. So the first thing is that when we're growing as children, we actually don't have the survival switch is not really turned on very much. It is turned on when we're eating sugar, but when we're not eating sugar, for example, high glycemic carbs, we don't have much of the polyol pathway initially in us. It has to be induced. And so when you're a kid, and also you can't absorb fructose very well as a kid. So, and that's because most children are being breastfed, and our babies are being breastfed, and nutrition is not as big an issue. Well, it can be a huge issue, but in general, when we're initially born, we do not have much of this polyol pathway present. But the more sugar we eat, the more fruit juices and stuff we eat, it will increase the transporters for fructose, as well as the enzymes to make fructose, and as well as the enzymes to metabolize fructose. So that over time, we become more and more sensitive to sugar. So if a 6-year-old is not going to be as sensitive to sugar as a 60-year-old, because initially we don't have the system upregulated. So for example, we did a study in children, 14-year-olds, where we gave them a dose of fructose. And some of the kids were lean, some were obese, and some were obese with documented fatty liver by biopsy. And when we gave the dose of fructose, the kids that were lean absorbed only about 2/3 of the fructose. Even though they drank it, they only absorbed 2/3 of it. The kids that were overweight absorbed about 80% of it. but still didn't absorb it all. But the kids that were overweight with fatty liver absorbed it all, basically 100%. So it turns out that our ability to absorb sugar increases with the more sugar exposure we have, and possibly genetics, but a lot of it is exposure. So that's one thing. A second thing is that when we're young, we tend to have very healthy energy factories. And if you're 22 years old, you may feel invincible. You can drink your soft drink and run up and down the beach, and they'll make ads with you, and you can feel like you can eat anything you want. And I don't know about you, but when I was 22, I could eat a huge amount of food. I didn't have to think about the type of food. It could be pizza, cake, whatever, and I wouldn't gain weight. And and that's because my mitochondria were so strong that it was very hard to really trigger that big switch. You certainly can do it if you drink a lot of soft drinks, even or a lot of sugar. You can trigger it as a teenager or as a kid, and some kids are doing that for sure. But in general, the healthier your mitochondria are, the harder it is to activate the switch. And this is why, like these super athletes that do the Tour de France and things like that, some of them can drink sugar without really showing much biologic effects because they're just the mitochondria are so strong. But over time, it's going to take a toll. In women, there's another thing, and that is that women tend to have a lower uric acid level than men. And this is especially before menopause. And this lower uric acid level is associated with a slightly less risk for developing diabetes and hypertension, and it's sort of as a protective mechanism. But when you go through menopause and your estrogen levels fall, your uric acid levels will start to go up, and you'll start now having the same kind of risk factors as men. The risk for developing heart disease and obesity and diabetes will increase. And what can we do about that? Well, the most important thing is to be aware that this happens, and then to be aware that that uric acid levels are going up, and so that you're going to become more sensitive to these foods, and like sugar and high glycemic carbs and so forth. So and there are natural ways to try to keep your uric acid down, and obviously eating the right foods is probably the most important way. Exercise can actually lower uric acid, and exercise is really a wonderful way to keep your mitochondria strong. And so, but yeah, there is this effect when you go through menopause.
So when you talk about, just coming back to those teenagers that you were talking about, where you had lean, slightly obese, and then obese with confirmed NAFLD, it seems that you can almost like, with the consumption or increased consumption of sugar, almost have like a phasic shift in terms of your sensitivity for activating this pathway. Yes. So the more sugar that you consume, the worse it becomes. And then when it relates, to your point about women with under the influence of estrogen, with this, call it maybe a protective effect, in that it increases uric acid secretion. That kind of comes back to what we were saying, just a moment ago. Like when you're 55, let's say, you can't eat the same way that you did when you were 25. And That's one of the reasons why I really love, for women in general, I love there to be, and I've spoken to Dominic D'Agostino about this, for there to be like this therapeutic intervention of a low carbohydrate and therefore low, glucose consuming, low insulinergic environment, so that we can start to heal some of these, we can lower or attenuate some of the chronic activation of some of these pathways. And then, for women who are still in their reproductive years, I like to cycle things based on their menstrual cycle, et cetera. But yeah.
Yeah, I mean, one of the most important things, which I really haven't focused on, is that the way this switch works, you know, you eat sugar and you get this oxidative stress to the energy factories, and this suppresses the energy produced by the mitochondria and triggers this biologic switch, okay? And so initially when you eat the sugar, you get this suppression of mitochondrial function, but then it will recover, you know, when you're not eating the sugar, and so it's kind of like a temporary. But what happens is that when you continually eat the wrong foods for a long time, this oxidative stress is recurrent to the energy factories, and over time wears the energy factories down, so that you start actually losing some of the energy factories, and so the mitochondrial function goes down. And when that mitochondrial function goes down and becomes permanently low, then you sort of become permanently overweight. And it's like you're trapped at a certain weight. And then if you try to lose weight, you can lose weight by just, you know, reducing your caloric intake, etc. But then you want to go back to that weight. And so you almost kind of get locked in to this higher weight. And there is a way to break it. This is amazing, but it's really true. And the first thing is you know, you want to reduce the foods that cause this switch, like sugar and carbs, and just
breads.
like what you're doing.
Yeah.
And that we actually did a study in people. We found that is just reducing the injury allows the mitochondria to recover. And the mitochondrial, you get this thing called biogenesis where the mitochondria actually start coming back. So just by reducing sugar, you can do that. Another thing you can do is to exercise. And or intermittent fasting is another way when you remove sugar and all foods that allows the mitochondria to recover. So intermittent fasting is also great. But another one is exercise. And I really like the exercise because I think that not only does it make you feel good and gives you you know, and it does burn a little bit of calories, but it's not the burning of calories that's important. Really that is like the least important. What it's doing is it's stimulating the growth of those energy factories, and that is giving you more energy, and it's going to allow you to lose weight and keep the weight off. And so, you know, and vitamin C is also good for those mitochondria, especially at a dose of about 500 milligrams a day. I would not go to super high doses because you can get kidney stones, and there's some evidence that at real high doses it may block the ability of the mitochondria to regenerate. So it's sort of a controversial area, and I don't think it's proven, but because we don't totally know, I would not go over a gram of vitamin C a day. But 500 milligrams a day for sure works. It's good. That and exercise and intermittent fasting and low carb diets. And you know what's really great, Stephanie, is that when you do these studies, what you can show is that you know, when we did the science, it becomes apparent that this is why low carb diets and intermittent fasting work so well, and people kind of discovered these pathways or these diets and approaches because they worked. And here, you know, I'm coming from the science, and suddenly I'm finding, oh my God, this is why the low carb diets are working so well. This is why, you know, it's important to cut back on salt. This is why, you know, exercise is so good, because it's intervening through this pathway, and so it's like converging of science with what people have discovered from trial and error. And it's just great.
It's a beautiful thing.
Yeah.
When you say exercise, are you referring specifically to resistance training, cardiovascular, and cardiopulmonary work, or is it just like movement in general, like low, steady state, high intensity interval training, or is there?
Yeah, it is a special type of exercise, and it's really what we call zone 2 exercise. So it's really sort of like jogging or biking or where you kind of try to raise your heart rate up a little bit, not to the point where you can't talk. So my friend Inigo San Millan, who's the coach of the Tour de France winner and so forth, and he's like an amazing physiologist. And his whole purpose of to try to make super athletes super is to try to improve their mitochondria. So his whole career has been on how do I improve a person's mitochondria. And his work, as well as others, have shown that what you want to do is you want to do like 30 minutes to like 60 minutes of exercise at one time. So you need to do this like 3 times a week. Maybe you could do three 20-minute, periods in one day. But basically, you need to have it be sustained for a period of time. And what you do is you try to get your heart rate up to the point where the mitochondria are still burning fat and don't really go into the anaerobic phase. And so what you as soon as you start building up lactic acid or lactate in your blood, that's when you're doing it too much. And so it's actually mild exercise. We call it zone 2. And the trick is to exercise to the level where you are able to still talk to someone. So if you're, but it's a little bit difficult. So if it's really easy to talk to the person next to you while you're walking, you're not walking fast enough to really trigger this mitochondrial growth. You want to get to a point where you're just having a little trouble talking. And at that level, you are working on your body to make mitochondria. And as you get better, you'll be walking faster and then at that level, you're going to have to get again to that point where it's a little hard to talk. And if that's going on, then you're at the right spot. And you can also measure your lactate, like with a earlobe monitor. And, there are ways to do it if you want to be more specific. But yeah, no, I think that the power of exercise is something that, a lot of us, who are workaholics, we tend often to ignore the importance of exercise. And we think, if I want to be healthy, I just, eat healthy. But exercise really has a major purpose for us, and that's to help keep our mitochondria healthy.
When we look at autoimmunity and the frequency, the rate at which it happens in the female population, part of that is due to our cortisol response. And as you said, it's a counter-regulatory hormone. It counteracts inflammation. So when we have, for example, we all do this every day. We all make, cancer cells. We all make autoimmune, they're mistakes that happen. But, 99.9% of the time, the autoimmune cells are checked. We make sure that they're, before they're released out into the body, they're checked to make sure that they're okay. If you don't have that pulse in cortisol in the morning, we often will see, or I've had patients report that they're, women with hypothyroidism or Hashimoto's, it's worse for them in the morning. Like they feel puffy, joints are killing them. And to your point, it just takes them that much longer to kind of get up and running. And it's because the cortisol is not doing its job. It's not bringing down that inflammation or checking that central tolerance around checking for those autoimmune antibodies.
And which is really unfortunate because a lot of people, when you ask about their autoimmune symptoms, they'll say, I wake up feeling puffy. I wake up hurting. I wake up so tired. I wake up feeling thyroid or whatever it is. I wake up, with RA. I wake up with joint stuff. And cortisol, as you said, plays such a big role there. And even the further development of autoimmune, maybe you don't have autoimmune, but if you've been going through a lot, and which is what we'll discuss later, which is burnout, but if you've got burnout and you have sort of a flatlined cortisol, your risk for developing autoimmune could go up because you don't have the ability to kill the cells that are accidentally formed autoimmune in your body. So like you said, that pulse of cortisol does a whole lot.
Yeah, so important. It's just that, we often, and I'm glad that we're talking about this and hopefully, nailing the head in the coffin around this idea that, cortisol there's a reason for it, right? Just like there's a reason for insulin. These things are demonized often. Estrogen is another one, cholesterol. Like these things are demonized in these little sound bites that I think we misinform often, marketing managers where they put out these little like easy to digest sound bites. You really miss the nuance. Like you need cortisol in the morning. You don't want it in the evening, right?
Yep, absolutely.
All right. Let's talk a little bit about cortisone and the ratio between, or the conversion between cortisol and cortisone. I'm running currently a hormone program, and it'll be available even when the live questioning is done, or the live segment of the course is done. People will still be able to join. And we were talking a little bit about cortisone on it, and so many people were like, "What's that? What do you mean inactive? Tell me about it." So I think that you are a seasoned expert here. Can you explain the inactive form of cortisone to the active form of cortisol, why that happens, maybe preferential tissues where we see this happening as well?
The body makes cortisol first. So the adrenal glands pump out cortisol. But then the body's really smart because cortisol in excess can be a bully and it can bind to receptors, which are known as aldosterone receptors or mineralocorticoid receptors. And it can affect our salt water balance, and it can screw up some of our tissues and our other receptors. And so the body's like, you know what? You need to simmer down. I'm going to deactivate you when you're a problem to a hormone called cortisone. Now, it's very important you don't confuse hydrocortisone cream with cortisone. So hydrocortisone, like the cream, it's a naming thing by pharmaceuticals and it's stupid. Hydrocortisone is actually cortisol. So when you buy hydrocortisone cream, 1%, 2% at the store, that's actually cortisol in cream form, just FYI. Cortisone, no hydro, is the inactive form of cortisol, meaning it cannot bind to receptors, it cannot do the things, it cannot turn them on and cause any kind of damage or destruction or affect glucose or anything. And the reason again for that is protective, because if cortisol is bombarding an area of receptors, let's say the kidneys, and what's going to happen when cortisol rushes the kidneys, you can develop hypertension, because believe it or not, a lot of your blood pressure is monitored by and accounted for by your kidneys. And so the kidneys are like, enough of this, and it will deactivate to cortisone to protect itself so you don't have any kind of high blood pressure, kidney damage, what have you. Other areas that have the ability to turn off cortisol, the saliva glands, certain parts of your intestines, your sweat glands, these all can you've got it. Let's dial you down. And that's what it can do. Now you can reactivate though. It's not a one-way path. You can be cortisone, which is inactive, and you just sit there. And then the body can be like, all right, we need you now, activate. There's an infection or there's a glucose issue or, we need to power up. And so now you can activate back into cortisol. And it primarily does it, unfortunately, in our adipose tissue, our fat tissue, but we can in other parts of the adipose and in other muscles and glands and organs that can do it as well. So it's a checks and balances that happens all day long. The primary purpose is to protect you, but things can go awry, and you can be a deactivator under certain circumstances, or you can be an activator under certain circumstances. And so that's why it's really helpful. And again, I'm totally biased. I work for the Dutch test, but it's really interesting to see people. I'm a deactivator. I was experiencing burnout at the end of 2020 into 2021, and all my cortisol was getting deactivated into cortisone. And my body was like, hey, Carrie, chill out, rest, stop, say no, set boundaries. And I was like, okay, fine. There it was on paper, and I had to listen. And so it is nice to know the difference between them.
Yeah. And it's, I think for women, I'm so happy you said this, because I think for women, we did a training inside my Hello Betty membership around boundaries, and people were like, but what if someone gets upset with me for setting a boundary? We're so scared to protect ourselves. But when you see it on paper, as you said, it's like the hormones, they don't lie, it's like, girl, you are running yourself into the ground.
Yes.
Like, please start saying no. And I know for those of you that are listening on audio, you can't see Carrie's background, but she has a little sign that says healing happens at joy, which, when you start to set boundaries for yourself, all of a sudden you can get closer to your desires. You can get closer to joy. You can get closer to bliss, which is just really, I think, so potent. And we can talk about the pathways, and we can talk about beta hydroxysteroid 1 and 2.
Yes.
And, we can talk about those things, but at the end of the day, it's important for you to understand that your hormones are a reflection in many ways of how your genes and how you are marinating those genes in your lifestyle. Yeah. So as you said, end of 2020, who else can relate to like having a stressful bad year, in 2020? And of course, there was a really big conversation among many physicians around physician burnout, and really feeling very called to serve their communities and help, understand and explain the science for people. But of course, at the expense of their health. So,
right.
Let me ask you about. I'm focusing this as I've said. Around women, how can stress affect a woman's menstrual cycle? So I think that many women, how I'm always talking, I'm all about cyclical living. Like, I want you to eat for your cycle. I want you to train for your cycle, supplement for your cycle, etc. But how can the this sympathetic dominance or this chronic low grade stress and inflammation, and I say stress and inflammation, for me, those words are sort of interchangeable with each other. Yeah. How can this, as it relates to a woman in her reproductive years, including a perimenopausal woman, because she's still technically in her reproductive years. I've had patients who are pregnant at 47, so it's still perimenopause, but still menstruating or still cycling. How can stress negatively affect in excess a woman's cycle?
The body, the brain is always scanning to make sure as a female that you're safe and healthy enough to have a baby. Now, you may not want a baby at all. But that's those of us born with ovaries and uterus. That's the way that the brain feels, functions, surveys every single day. So your hormones are not released like a garden hose. They're not like turn on hose and out comes the hormone in a continuous steady stream. Our hormones are pulsed, and the pulse is almost like Morse code because every hormone has a different type of pulse to it. So when you are trying to, let's say, make estrogen or make progesterone, your pulses change. And the pulses from the brain down to the ovaries that make progesterone are bigger. So they're higher in amplitude, but not as often. So big rush, and then it stops, and you wait a while, and then it does it again. Estrogen's pulses are lower. The signal to create estrogen are a lot lower and more often. Now, what happens with stress, cortisol, inflammation, infection, whatever it is when that occurs, the brain goes, I do not feel safe enough, and I do not feel healthy enough to have a baby this month. And so what I'm going to do is I'm going to alter her pulses. So cortisol, infection, inflammation will start to suppress the pulses. Usually the pulse that gets suppressed first is the high one, which is the pulse that creates progesterone. So it starts to drop down, and now she doesn't ovulate, or her cycle is longer, or she skips a cycle completely, or she cycles, but it's like super heavy, or periods are heavy, and her PMS is wretched. And then eventually, if it's bad enough and long enough, the pulses that create estrogen start to go down as well. And now she, again, skips cycles, doesn't have a cycle. It's a very long cycle because the body is like, this is not a safe place right now. We need to divert resources away from reproduction and put them towards fighting the fight, putting out the fire, healing, recovery, whatever it is. And so it's this interesting pulse diversion that stress causes from the brain down.
And it's literally, we need to survive right now. Like that's essentially, you move into this like survival mode, because being pregnant and, optimizing your fertility like you said, irrespective of whether you want to procreate or not, that is a vital, that is a marker of vitality, right?
Yes.
Like your fertility is a marker of health for women. And I think that when you are in this survival state, you have all these, like there's all these feedback loops, as you said, right? Progesterone is down. You have the feedback loop that down regulates FSH and LH, which now, you were talking about the pulses around estrogen. So now we're not going to have the development of a follicle or the release of a follicle. So we have these anovulatory cycles, as you mentioned, or you have the excessive, like the crazy bleeding. Sometimes we'll see like, very heavy bleeding for women in perimenopause, which can be very scary, right? Or they'll bleed for a really long time because they've had this unchecked estrogen relative to progesterone. It's often called estrogen dominance. So what are some of the, and then let me also ask about menopausal women, because I'm building up to a point here for a menopausal woman now. She doesn't have the ovaries have retired, right? So we don't have the cycle anymore, but we still have these sex hormones now being produced, albeit, lower levels.
Way less. Yeah.
Way less adrenals, the adipocyte. So why is it important for a woman? And I would argue that it's more important as the older that you get to manage your stress. So why is it important for a menopausal woman to also be paying attention to her stress levels as it relates to these hormones?
When you are cycling, this is how I view it. So when you're cycling and even into perimenopause, your ovaries are still a fully functioning gland, or at least a partially functioning gland. And they are taking a lot of the pressure off of your other glands to carry their load of the work. So for those of you, maybe in your job, you work with a team. And so everybody on the team plays a role. And if somebody's on the team is not really doing their job or missing or retires or quits, then either you have to pick up the slack or you have to hire for that position. In your body, you can't hire for the position. You can't. So once the ovaries do decide to retire, then the adrenal glands are like, where did lefty and righty go? Like, who is making estrogen and progesterone, and who's picking up the slack? Nobody's really picking up the slack, which is why the hormones drop so low. So you miss out on all that lovely, robust estrogen and progesterone that was helping so many things way beyond female health, way beyond making a baby. I mean, all your immune system cells have estrogen on it. Your estrogen is super critical for your brain, just like progesterone is, your bones, your joints, your skin, your heart, everything. And so now with menopause, as those levels drop from way up here to way down here, and cortisol and the adrenals and your adrenaline system is like, oh crap, they get more triggered, they get more sensitive, they react more because you don't have the lushness of the estrogen and progesterone to help carry the weight with everything else. And so what I tell women is that when you're going through menopause, it's like reverse puberty. So if you remember all the, crap took to get you into puberty and, how awesome that was, and now imagine backing out of it. And so you need your stress health, your stress response, how you manage stress dialed in at that time, because it's a wild ride if you haven't gone through it yet, or you're not in it yet. And it in itself can be stressful. And then you add the world on top of it. You add your family, you add your kids, you add your job, you add the news, you add a virus, you add a pandemic, you add chemicals, intoxicants, and on top of, and it's just the last drop in the bucket, and the bucket overfloweth, and you don't feel very good. So I 100% agree with you. When women ask me, at what age should I start with stress management? I'm like, yes.
Yesterday.
The earlier, the better. When it's women in their 30s, I'm like, start now. I know you are at the height probably of creating maybe families or your job or your entrepreneurship or whatever it is. And you feel like, I don't have time for this, and I seem to be doing fine, and it's totally fine for me to burn the non-toxic candle at both ends. But trust me, if you continue it, it's going to make your 40s and 50s a lot rougher. And just like you do, I see it all the time in my patients who slam into perimenopause and menopause as opposed to slide or glide into perimenopause or menopause.
Yes, well said. So let's move into some common presentations. And I think, we'll get into low cortisol in a moment, but I think for where most of us start is excess distress, right? So we've been talking about, stress, and I know that we haven't really delineated between eustress and distress, short, acute, and long and chronic, although we've, thrown those terms around. But anything that can be considered a good stress, a eustress, something like fasting, something like exercise, cold, heat, these can also, if we don't stop, if we over exercise, if we aggressively fast, if we, don't regulate our core body temperature, we don't regulate our, light viewing behavior, et cetera, these can all turn into chronic stressors. And I think what ends up happening is we start to see, we were talking about this diurnal pattern of cortisol being very high. Normally we want it high in the morning and sort of ski sloping off towards the end of the day. And what I would often find when I would do the Dutch with my moms is we would almost see like an inverted curve. Like it was at 3 o'clock, like all of a sudden 3 or 4, like time when we pick up the kids, right? It's like time, the cortisol spikes there. The other time we would see it is in the evening.
Yeah. I call it my mom curve or my entrepreneur curve.
Yes, exactly.
Same curve.
Yeah, same curve. So let's talk about, and I thought I was so clever in my book, The Betty Body. I said, I was like, I made up some sort of almost like a fabricated relationship. I'm like, there's an inverse relationship between sunlight and anxiety, because as the sun goes down, I thought I was being very clever. I think I was the only person who got that joke. But let's talk a little bit about signs of high stress in the evening. What would you clinically, and of course we're saying this, you're a doctor, you're not everybody's doctor here, but what would be some things that would tip you off? Put on your clinical hat and say, dysregulated HPA axis for high cortisol levels in the evening.
The biggest thing is I can't fall asleep. I can't wind down. As we get into the evening, I feel wired again, even though I'm tired. So I'm wired and tired in the afternoon. My pulse feels racy, or I feel more hypervigilant, sort of on deck, maybe a little anxious. I feel the need to get things done. I feel like now the kids are in bed, I can quick check everything off my list. I can quick get through laundry and email and, watch the show and do the dishes and even just describing it to me, the women are a little bit like, I'm like,
yes,
okay.
Yes.
They're like, there's not enough hours in the day. And so again, and it's the same with entrepreneurs. Like, well, I put the kids down and then I finally have a few hours free where the house is quiet and I can plow through the emails and I can finish off the ebook and I can launch the thing and I can respond to DMs. And I'm like, okay, I get it as an entrepreneur, but at the same time, you are revving yourself back up into that cortisol state. And a lot of times people are doing it under bright lights, or they have their TV on, which is bright white light. They have the lights on in the house. They're staring at their screen. They're on their phone, the bright white light. And the way light plays a huge role in how our cortisol is or isn't produced. And so we have these nifty little genes in our brain. They're called the clock genes, just like the clock on your wall. And they set our circadian rhythm every day. But our circadian rhythm is a little longer than 24 hours. We as humans abide by a 24-hour law, but our circadian rhythm naturally is a tiny bit longer than that. So in order to set and reset our circadian rhythm every day, we need light exposure in the morning and we need darkness at night. That's how we rein ourselves into about 24 hours. And so if you have light at night, your ring lights up, you've got your phone on, you've got your desk light on, what have you, as you're doing your nighttime presentations and whatnot, then it could, especially if you do it night after night after night, a one-off is no big deal, but one night after night, it's going to tell your brain, oh, white light, don't make melatonin, keep that cortisol up, keep that norepinephrine and epinephrine, keep the energy rolling. And then you go to relax, and not a lot of people can just flip the switch and go, okay, I'm done now, time to go to bed. And it can be a real problem. So as I start to hear that, go, do, and I can't sleep or fall asleep, stay asleep, then I start to think, I bet your cortisol is high at night. I bet you're kind of wound up.
Let's move into menopause and perimenopause. Lots of my ladies that listen to this podcast sort of fall in that age range. And perimenopause is this sort of diabolical time where you sort of start off with, it can start off with one issue where you start off maybe more estrogen dominant because your levels of well, I should say your estrogen levels are high relative to your progesterone levels, but then over time it switches where your estrogen levels were once relatively high. As you have more ovarian insufficiency, we start to see lower levels of estrogen. So walk us through how that can affect the female brain. What are some symptoms that she might be experiencing or that might clue her in to this flux in her estrogen levels?
What I think with perimenopause is there's a loss of pituitary ovarian feedback loop. So what happens is normally the normal menstrual cycle, the pituitary releases follicle stimulating hormone, which causes the release of the follicle. And then, you get into mid-cycle, you get an LH surge, you ovulate, you then put out progesterone. And then what happens as women get older, their feedback loop becomes less efficient. And then what will happen is FSH levels will have these less efficient effects on the follicles. And then we get what happens is there's spikes of estrogens that go up and down. And it's really spikes of estrogens going up and down that cause things like hot flushes and sweating, insomnia. And, for females, when we talk about perimenopause, some transition very efficiently through it and some do not. Mm-hmm. Some will just go, hey, my cycles started getting longer and longer, and then I just didn't have them. And it was really no big deal. I don't know why people complain about it. And then other women are like, I'm going to kill everyone in my family. I need help.
So true.
This is too much. Yeah. So they can't adapt. And they're the ones that have these fluctuating estrogen levels all over the place. And they're really in a bad place. And part of that is they don't have the compensatory mechanisms to deal with it. So normally, our adrenal glands also produce this estrogen. So if their adrenal glands are not as efficient physiologically, then they can't stop those to balance out for those fluctuations. So those fluctuations between FSH and estrogen are going to happen because of normal aging. If the adrenal glands are working, then they can balance out these humps. So if the levels drop, they can quickly bring it up. So as soon as the levels spike, the adrenal glands kick in and bring it back up. So there's never really big dips. People that don't have that compensatory mechanism, they have huge dips, and these huge dips are causing these vasomotor responses that are causing hot flushing and sweating, and also estrogen levels spiking up and down impact brain chemistry. So they can all types of mood disorders and depression and all the things that go with it. Mm-hmm. So it's really important to really have healthy adrenal function before you transition into perimenopause, which goes back to, I guess, the theme of everything we talked about is blood sugar stability, make sure you're not hypoglycemic, make sure you're not insulin resistant. Those things can make a big difference to have the health of the adrenal glands so you can physiologically adapt if you're going into perimenopause. Now, if you're already in perimenopause and dealing with all this stuff, then you're just basically in crisis care and trying to control symptoms. When people go on estrogen replacement therapy, their estrogen levels are just now stable all the time, and maybe even high, but they're stable all the time. So they don't have any more symptoms. And they sometimes they confuse it as, I must have been estrogen deficient because now I'm taking estrogen and now those symptoms are gone. So it was a deficiency issue, but it's not really a deficiency issue. It's a spiking, fluctuating issue. Mm-hmm. And
so it'd be like the lack of the adrenals to compensate for.
Yeah. So if your estrogens are always, if you're taking it every day and you always have an X amount, there's no more spikes.
Right.
But then this is where, some of the concerns come in for some not all, but some susceptible women that have estrogen receptor sensitivity for certain tumors or have different clotting genetic uniquenesses where estrogen really promotes clotting. Because mm-hmm. we know that there is, for some group of women, there's some increased risk for strokes and heart attacks and embolisms, and even some estrogen-sensitive cancers. So, sometimes women are like, well, what do I do? And then the thing is like, if you have a person that's having the estrogen fluctuation levels and they have significant hot flashes because they were able to compensate and they go on estrogen replacement, they think now that they were estrogen deficient and they need to be on it forever. And then they stay on it. And then maybe they go, I don't want to be on this anymore. I have risk factors in my family. I really, don't like the way my fibrinogen levels are looking, whatever the case may be. And then when they go off, all of a sudden their levels now totally drop. And also when you're on estrogen for a long period of time, the estrogen receptor sites lose some sensitivity, so they become resistant also. Now when they go off, it may take 2 to 4 weeks for these estrogen receptor sites to regenerate to deal with not having those hormone levels. They're going to get all their perimenopause symptoms coming back.
And
so now they're confused. Yeah. And now they're going, oh my God, I have to take estrogens. I'm just deficient. But when you look at their labs, they're off the chart with estrogens, and they may have some risk factors.
Mm-hmm.
So for them, sometimes just getting through that phase where their levels get cleared out of their body and the receptor sites respond, something they have to go through if they're wanting to transition out. But then there's also research that shows, estrogens are really important for brain health, and women that are on estrogen replacement therapy have greater neuroprotection and have greater bone density. So, there isn't a simple answer. There's all these different factors involved. Ultimately, at the end of the day, you have to look at the patient's risk factors, their symptoms, their personal belief system of how they want to manage their own health, and to try to figure the right option for them. But perimenopause, those are the main issues.
And how would you introduce adrenal support there? So if if you have the inability of the adrenals to have this compensatory output of estrogen because of chronic stress or chronic inflammation, what are some of the strategies that you like to employ? And of course, I know it's individual for each patient, but what are some general rules, some general guideposts that you like to employ when we're thinking about adrenals? And maybe it's not just the adrenals, maybe it's like the HPA axis and like the sympathetic tone of the person. Like maybe you can, what are some things you like there?
Well, if they're already in the perimenopause stage, and it's almost too late to get any real effect from that. Other than you still have to stabilize your blood sugar levels, you still have to reduce their stress, to get sleep. Those are the main lifestyle things. So basically you have lifestyle factors, you have dietary factors, and then you have nutraceuticals you can use. So lifestyle factors, they got to get proper sleep. They have to reduce their stress levels to the point that it's not taxing their soul, their spirit, their mind. And then they have to get some degree of physical activity or exercise to reduce their stress, not necessarily overtrain. Those are things that help support the adrenal glands.
And recover. No one recovers. No one, like you were saying, the professional athletes, like we will go to, a CrossFit 5 days a week, especially like the type of women that I tend to attract, the same woman that I am, which is like type A, overachiever, nerds out on everything, no rest. And then when you don't recover, when you don't give yourself, because that's where all the gains are, right? You work out for, 4 days a week, but if you don't give yourself that fifth day or that sixth day to like just actually reap those gains, like nothing, you're always inflamed.
Yeah.
Yeah.
And then besides lifestyle, their diet has to just be, really high in healthy. I mean, it's basically a healthy diet and nutraceuticals. There's lots of different botanicals out there, things called adaptogens, rhodiola, ashwagandha, things people can sometimes do to support their adrenal glands.
What does a healthy diet mean to you? What does that mean to you?
Real food, not processed food.
Mm-hmm.
So healthy diet today, just basically that's what it means. Like real vegetables, real food has been processed. There's not a bunch of chemicals added to it. Doesn't come from a bag or box. That's like
simple. Shop the perimeter of the aisles, basically. Don't go up and down the aisle in the grocery store.
Yeah, I mean, before you get into like, should you be vegetarian? Should you do keto? Should you do all that? You just have real food.
In terms of nutraceuticals, would you ever that can help augment brain function in women or men? Would you want to target like the acetylcholine, like we were saying, maybe GABA for someone who is very anxious, or serotonin to help with some of the mood disorders and cognitive thinking?
Yes and no. I mean, you can do them. In my brain book-wise, in my brain working, I have a chapter for each one of those neurotransmitters: acetylcholine, dopamine, GABA, and serotonin. And I just review the literature of all the things that have ever been shown to raise those levels. Lots of natural compounds have been shown to raise those levels. It's kind of not it depends on what your clinical goals are. If your goals are to improve your memory, focus, and concentration, you can do things to raise your acetylcholine. If you have a tendency to anxiety and nervousness, there's some natural compounds that can help activate GABA receptors to kind of take the edge off, and then same thing with dopamine and serotonin. But ultimately, in the way we teach people these concepts in my Save Your Brain online course and in the Why Isn't My Brain Working is that's not the most efficient place to start. The most efficient place to start is get proper fuel to the brain, get proper oxygen, meaning proper circulation, blood flow to your brain, make sure you get your blood sugar levels under control, make sure those things are all in order before you start going into the neurotransmitter route. Because if you go to the neurotransmitter route first with different nutraceuticals, botanicals, you really don't get much of a clinical effect.
Mm-hmm. Mm-hmm. So let's talk about how we can build a healthy brain. We've been sort of talking about all the different, catastrophic events that can happen from neuroinflammation, from brain fog, from chronic stress, sleep deprivation, blood glucose levels out of whack. In your book, you talk about ways that we can build a healthy brain. And one of my dear friends, Jim Quick, is a brain coach, and he talks about the way that you build out neurons is through nutrition and novelty. And you talk about this very similarly. You talk about having
What's novelty?
Novelty meaning like stimulation or things that are new to the brain. And you talk about that as well. You talk about stimulation, you talk about oxygenation to the brain, you talk about glucose levels, which we've been talking about a lot. I want to touch on oxygenation because just because you're breathing doesn't mean that your brain is getting oxygen. And I would notice this. It was such an alarming trend. I would typically, I used to have a brick and mortar practice. Now my practice is mainly online, but we would take new patients somewhere around 10 o'clock in the morning. So we'd have sort of this rush of, patients coming in for their care between like 7 and 9, and then, 9, 10, 11 o'clock, new patients, we take them. And we would just pop on an oximeter for them while we were doing HRV or some other test. And these are like 30 or 40-year-olds. That was sort of the demographic of the patient base that I had, maybe 50. And they would have at 10 in the morning O2 saturation levels of like 94%, which is low for 10 in the morning. So let's talk about, first of all, why that's problematic. But first I want to talk about why, what the role of oxygen, what that is in the brain, and what are some of the confounding variables that can influence the ability for oxygen to permeate and get into the brain.
Sure. I mean, pulse ox 94, you got to rule out pulmonary issues, cardiovascular issues, and asthma and all those things. That's not anywhere close to healthy or normal.
Yeah.
It's definitely a red flag. Mm-hmm. But when you look at the pulse ox levels, pulse ox is just one way of looking at it, calculation of different lights going through red blood cells that are oxygen unconjugated, and you get a number. It's not necessarily, it's one way to look at this, but also just temperature, just cold hands and cold feet. It's a good way of looking at circulation, which may not always reflect the pulse ox, because you could have someone who has a pulse oximeter reading of 98, 99%, but their hands and feet are freezing and cold. Right. So the most common things with getting oxygen to the brain, blood is really, first of all, blood pressure. People that have very low blood pressure have what's called low perfusion, and perfusion is the ability to push oxygen into your tissues. So, a lot of people have really poor brain endurance and brain function because their blood pressures are just too low. So, let's say systolically below 100 or diastolically, below 70, like 90/60 or something like that. That's really going to impact perfusion, cause poor circulation in hand, feet, cold hands, poor nail beds, wet nail beds, and it's also mean less oxygen to the brain. So for some people that come in my practice and we're really looking at how to improve their brain function, we may just start with looking at strategies to improve their blood pressure and why their blood pressure is so low. Mm-hmm. So that's under the line of oxygenation. Anemia always has to be ruled out. We got to make sure that you have to do a CBC to make sure there's no underlying anemia. But of course, there's lots of different causes for anemia. But things like anemia and poor circulation, poor blood pressure are really important mechanisms that decrease oxygen delivery to the brain, but also decrease blood perfusion into the brain, especially when you look at blood pressure and circulation. And blood is really where it carries all these nutrients. So if you have someone who's got really poor perfusion, really cold hands and feet, really low blood pressure, even if they're taking lots of nutraceuticals and their blood is filled with all these different vitamins and minerals and things to support the brain and flavonoids, they can't get into the brain, can't get pushed into cells, there's no effect.
Right.
So when it comes to the field of oxygenation, perfusion, oxygen, those things are all really, really important. And then some people have things like asthma, and they have pulse oxes that are really low, and it's environmental, and you have to remove. They find out, you do some testing and you find out they're sensitive to the different trees in their neighborhood, and they can't breathe well. They're always they're getting bronchoconstriction. So they do have that low pulse ox. So in order to change your brain function, you have to deal with the histamine response of their exposures. And, so that's the key thing with looking at a physiological aspect of brain, and as it relates to oxygen.
Are there ways that you like to improve oxygenation?
Well, so if there's an underlying mechanism, like it is bronchoconstriction, like asthma, that would be one approach. If it was low blood pressure, that could be a different approach. They just have there's no real cause, and their circulation's just always been bad. Physical, like high intensity exercises can raise endothelial nitric oxide levels, which can help with circulation and blood flow. There are nutraceuticals that can help aid with blood flow and circulation. Beetroot extract has been shown to raise levels, and postatine is very good to raise endothelial nitric oxide levels to help with circulation and blood flow. So that's a combination of things, and everyone's unique. There's some people you struggle forever to try to figure out how to get their asthma under control, and it's not like a quick thing. You have to work through different factors. For other people that have low blood pressure, you can try all these different strategies to get the blood pressure back up, but they don't respond as well. So, as you know, from your practice is different, and I think this is the frustration. Like, this is how it really works. So people that are trying to find the one protocol thing to do to change their brain, good luck. And then at the same time,
and also let me know once you find it. Let me know.
Yeah, once you find it. And then also when and then some patients don't have the motivation and drive to kind of address all those issues. So that's another factor. There's also the issue of practitioners. A lot of practitioners, how do you say it, just suck. They're the same mind. They want to just give someone a simple protocol or blame everything in the brain related to heavy metals, or they don't go through the detailed steps. And at the end of the day, it's a combination of all those factors that really impact a clinical outcome.
Right. Yeah, that's a really good point. I often find I want to be very careful, but in terms of respecting all my colleagues, but sometimes you'll find someone who is just all in for Lyme, everything is Lyme. That's because they've had either a personal experience, like someone in their family, and then they've figured out something that really worked well for them. And then that becomes the underlying thing for everyone, right? Or like you were saying, there's some cookie cutter thing that that you've developed, and then you just sort of give it out to everyone, irrespective of genetics, irrespective of the patient's goals, irrespective of, what you think is, what's actually going on. It's just they sort of want to, churn them in and churn them out. That's very true as well. So I want to move away from, the blame and the shame and to what you're talking about, which is let's just change things up. Let's just move into a different way of eating. And so you've been talking about these 5 different plans that you follow for 6 days, and we'll talk about the 6 in just a minute. But let's talk about each of them in turn. So we talked about keto, green, extreme, plant only, carnivore, which I am fascinated with as a tool for Hashimoto's. I have seen such incredible clinical results with that. And then the cleanse, and then the carb up. So can we talk about each of those in turn in terms of how they're different from each other, and then why you chose 6 days as each segment?
Yeah, definitely. So with the basic core, and I just want to emphasize what you said too. It's just sometimes when we're doing something, that bell curve, right? We're at our peak. Same with supplementation, right? For example, our vitamins, we can, feel great, but then we've over supplemented, taking the same amount every day. It's true with methylated B vitamins. When we have MTHFR, there's that sweet spot, but then you can take the same amount each day and you've oversaturated and you're on the other side of it. So that's not good either. So those pauses in our supplementation, changing up our routine, changing up our, our lifestyle, our physical activities, all of these things are intuitively part of nature. I'm not going to give you the same thing to do every time. And although I was like, everyone be keto green, because this is a way to live. And this is, oh my God, I'm like, so, feeling so amazing. I couldn't have done what I've been doing when I was 48, 47, I was a basket case. I was in that spiral. Keto green brought me out of it. So I'm like the keto green flag, right? And, but I've always said, 80% keto green, 10% feasting, 10% fasting. And that kind of, maybe it's 50% keto green. And, there's a variety there. But as I've worked with thousands of women through my books and through my programs, it became these things that we need to pause. So, for example, the Hashimoto's or the autoimmune, my MS patients, or the pausing the nightshades. And that's a great pause. And it's almost like step into, before you do carnivore, it's like, let's pause these nightshades. Let's take these away because they can be, immunostimulants. So we want to, erase that if that's part of what's going on here. And that's why I took those out in Keto Green Extreme. Plus it gives you a very great keto green diet just without the nightshades. And that kind of gives you the idea of what does it look like to be keto green. I'm not hungry. I feel great, have good energy, and no hot flashes, all of those things, because the way we're doing it is also part of the prescription, so to speak, the 6-day prescription. And then I did the plants to add the microbial diversity to support regular bowel movements. And then the carnivore plan to experience that nose to tail. Our ancestors, when we did carnivore, it wasn't driving through McDonald's without the bun and everything else, just getting the meat patties, right? I've heard people say that's how they're eating. And so that's not carnivore either. So what else is in that meat patty? We got to think about what we're eating too when we're eating it. So there's that. But also I've got this great liver, cardamom seared liver. I love my cardamom seared steak and cardamom seared liver. Amazing recipe. And it's so good. It's really so good for you. I'm making it tomorrow actually for my daughters, especially my daughter who's a new mom. So, and then the recipes that I put in there, nose to tail, right? To really incorporate that. We take adrenal supplementation, thyroid supplementation. Those are glandulars. We used to consume those. Used to be part of our food preparation, part of our menu. And then from there, I don't have to do it in any particular order. You can I have a Menopause quiz, and at the beginning of each chapter, ask you questions. This may be for you. And so the fifth plan I put in is a cleanse. And so that fourth plan is the cleanse. And that cleanse is, you're already in high ketosis if you are coming into it from carnivore or from a very long keto green lifestyle. So you're ready for that extra healing and diuresing and gallbladder liver support. And so I created that plan for that. And then the carb up plan to when you've been restricted for so long, adding in those carbs, especially if you're not sleeping well, if you're still struggling or you're getting a resurgence of menopausal symptoms, or you hit that weight loss plateau too, and then we can carb up. And I've seen some clients actually lose weight during that time. It doesn't happen to me when I do it, but I'm kind of envious of those clients, but it happens to them. And 6 days, Stephanie, because the gut, mucosal lining regenerates every 72 hours. So in 2 72-hour cycles, we get a glimpse of this feels good for me. The 3rd to 4th day of any plan, pretty much, that's your rough spot because you've just turned over, you're just creating, but day 4, 5, you feel the difference. So that 6th day is that minimum glimpse. And I would say 7th day, of rest.
One of the things that I really love about the carb up is my observation with people in keto for a long time is that they become insulin insensitive because they haven't been consuming like little to zero carbohydrates. That's true on carnivore. even on like a keto green program like yours, mine, I just call it the Estima diet, but very plant heavy, very similar to the keto green approach. And I have found that when we start giving that patient some carbohydrates, they actually can increase their insulin sensitivity again. And that is, we were talking at the top of our conversation, like cortisol, insulin, and oxytocin. These are really the three hormones that we really want to be thinking about primarily in perimenopause and menopause. Would you agree with that? Or do you have any further comments on that?
Yeah. Exactly. Yeah, exactly. My findings too. And that key. So the ketosis, we generate insulin sensitivity, but again, you can't let the pancreas be a lazy teenager on the couch all the time. You've got to challenge it. Those islet cells, right? You've got to challenge it. So, and then cortisol, certainly the stress and how we're supporting our body, our mindset. And that's an important part of this because again, the acidifying effects of long-term cortisol, especially in the perimenopause and menopause, when it's sucking away our progesterone, which is like the lid to the pressure cooker of our lives. So as that gets depleted, you're blowing the lid off this pressure cooker, and women will have psychoses, have mood swings, have nervous breakdowns, have, anxiety, depression, and that sense of that isolation that when cortisol's high, oxytocin's low. When cortisol's high is too long, the paraventricular nucleus of the brain is like, hey, cortisol, you are frying me out. I've got to suppress you. And you're in this dangerous state that many people have fallen into during the pandemic of low cortisol and low oxytocin. And that is that feeling of disconnect. I say the cortisol oxytocin disconnect. And that feels like disconnection. That feels like, oh my gosh, I don't even want to go into that office building anymore. I just can't stand the idea. I used to love doing that, but I don't even want to go in anymore. I used to, I know I love my family. I just don't feel love for them anymore, right? That I don't enjoy that isolation. I don't enjoy going out, or I'm not taking acceptance of invitations anymore, creating parties like I used to. That's that physiology of disconnect. And that's dangerous. That's the physiology of divorce. That's the physiology of burnout. That's the physiology of suicide. I mean, there's a physiologic play here that affects our physiology, affects our behavior. And so then we have to know that our behavior can then affect our physiology. So it's never just what we eat, right? It's the behaviors and the mindset around it that make something work successfully or not. That's that roadblock. Like you said, the negative self-talk to ourselves. I'm a failure again. I'm not doing this well enough. I'm whatever, right? I'm not enough. That's the problem there. And so you have to shift that mindset and, shift to the gratitude, shift to the wins, shift to the positive focus, shift to the things that we are doing well and that we do love about ourselves and love about our family, empower oxytocin, and we can empower our physiology so that we feel better, so that we can actually do more of those things that we love doing. Take the painting class, work in the garden, have sex with our partner, show up that confident, vibrant woman in our 50s, 60s, 70s, 80s, 90s, 100, whatever, the rest of our lives. And that is a physiology to that, and disciplines and practices that we incorporate to work together with our physiology. But oxytocin, that hormone of love, bonding, and connection, is that hormone at the end of the day is we want to look around and say, I have loved well, and I have been loved well. That's powerful.
All right. So just with the menopausal, women, there's a question in here around the best supplements for menopausal women. Do you have thoughts on supplements?
Let me tell you why I don't like it, because I want to start with this. Let's start with a foundation of a great lifestyle, especially when it comes to menopause. And that's really what the Menopause Reset was about, is giving women 5 things that she can do to change in her lifestyle as she goes through menopause. So let's start there. Now, having said that, when it comes to some go-tos that I think probably every menopausal woman needs, my absolute favorite is magnesium. I mean, menopausal women should just be like bathing themselves in magnesium and talk about not sleeping. If I don't have my magnesium, like my sleep is definitely off. So magnesium would be up there as a number one for me. And then you've got all your herbs, you've got your maca and all that, chaste tree and things like that. But I feel like if you dial in your lifestyle and you add in things that you may not be getting, the reason I love magnesium is you can't get it in your food as well. And even if you're eating food from regenerative farms, I just feel like we're not getting it as much. But then you're going to have to supplement. So magnesium's one. I would say zinc is another one for menopausal women, just to maximize hormone production. So I go to the minerals, but I'd really like to see her do great work with her diet and her stress and her fasting and minimize toxins and minimize stress and see if supplements are needed then.
100% agree. I think the supplement, as the name suggests, should be supplementing all of the other things that you're doing. So when I was sort of thinking about this question, the number one thing that I put as well was magnesium. I think that, it's better than diamonds. You don't need diamonds. You need magnesium morning and night. Like I love to take magnesium a little bit in the morning, and then I backload a lot of my magnesium in the evening. And that actually, coming back to that sleep question, the other thing I do in the evening is I take some magnesium.
Yeah. Yeah.
Because I find that it really helps. There's, and then I think if there's, when we think about being a minimalist around supplements, like magnesium would be there. If you are someone who's doing low carb or keto, or you're just training hard, I think that an electrolyte supplement is really important. So I don't know if you use or know this company, but I really like Element, LMNT.
Yeah.
Absolutely love them, because when you wake up in the morning, you're going to be a little dehydrated. I always take a little Element in the morning. And then that also helps with, just the body to hold on to water, because if you're doing low carb, of course, that. And of course, if you don't, I'll just say this because there's always a comment when I talk about a supplement. It's like, you don't need to take that. You can also just do salt in your water.
Yes.
But Element there's like sodium. I think there's potassium. I think there's some magnesium in there. And I'm forgetting the fourth. There's four of them that are in there. Maybe chlorine.
I think it's the three of the biggies in there for sure. Our community uses Element all the time, because when you fast, if you're not putting minerals back in, you're really depleting yourself. So, it's fun. You know what? I like Element because they have so many different flavors. So like literally before this interview, I decided, even though it's early in the morning, I was like, you know what? I had an early dinner. I'm going to break my fast early. So I add a little piece of, gluten-free sourdough bread. I put some almond butter on top of it. And then I sprinkled the chocolate salt element on top of it.
That is genius.
And a little bit of ghee. It was so good.
Oh my gosh, you're giving me life right now. I didn't even think to put it in to drizzle it as a little thing on your food.
I do it on cut up apples, and I'll put nut butter, or I'll put some like goat's cheese, and then I'll take some of the chocolate salt's the one I love. I
love the chocolate too. I love that. And I love the watermelon. Oh my gosh, I die for the watermelon. Yeah, that one's really good.
Yeah. And then, the mango chili one and all of those were meant to be mixers, Rob told me.
Oh, no way.
Yeah. So you put them in club soda, and then you put like tequila or vodka in there, and you mix it up, so that you're now getting the electrolytes that are being pulled out from alcohol, and it adds taste to it. But he literally made those as mixers.
Genius. I've always just been drinking them in water, and now I have like a new way to use them. I use like 1 or 2 of those sticks a day. I love that.
Yeah. There you go.
All right, let's move into some of the cycling questions. So there's a woman here. Do I still try to figure out my cycle after a hysterectomy? I thought this was a really good question.
Ooh. Oh gosh, I have so many thoughts on this. And here's what I will tell you. So the first is, I think we can never lose sight, whether it's a hysterectomy or post-menopause, we can never lose sight of the fact that as women, we have been cycling from the moment our period started. We have been in this rhythmic hormonal groove. So just because we've removed I don't know if she had her ovaries removed from a hysterectomy, but just because organs haven't been removed doesn't mean we're not still cycling. So the answer is yes, you need to pay attention to your cycle. But how do you do that becomes the next question. And you can do that. For me, I can tell you I'm 52, and just when I think I'm going to go into menopause, all of a sudden my cycle gets regular again. And so I've learned to know when estrogen is low, when progesterone is low, when I might need more testosterone. I've clued into my symptoms, and then I can shift my lifestyle accordingly. The other, and I'm curious your opinion on this, the other thing we've talked about in my community with a lot of postmenopausal women is the fact that many of us naturally cycle with the moon. So full moon being ovulation. So like if you take like the way I teach fasting, if a woman who had a hysterectomy, one thing you could do is just look at what I recommend for ovulation for fasting, time that with a full moon, and then follow the cycle of the moon.
Beautifully said. I would say the exact same thing. And that's actually part of the, in the Betty Body, I talked about that. So, we talked a lot about like you're in your reproductive years. These are each week that you need to eat this way, train this way, et cetera. But if you're someone who is no longer in your reproductive years, meaning you've moved into menopause, you still are a cycling being just by nature of being a woman. So I think that the moon or the lunar ebbs and flows are a beautiful way to still modulate the way that you are training and eating and your stress. And even like I notice, I don't always pair up with the moon, in terms of like ovulate is full moon and I bleed on the new moon. Depending on the length of the month or whatever, sometimes I'm a little off. But I think that it's a beautiful way to start noticing in how the moon affects your energy. Because I always have way more energy around the full moon. Like that's usually the time where I'm like, gosh, I'm like up and I'm cleaning and I have so much energy and I have, and I'm rearranging the furniture. And that's usually the time I'm like, oh, it's the full moon. That's why that's happening.
Yeah. I actually think on that topic, we don't give nature enough credit for how synergistic we are with it, whether it's the moon, whether it's, just what cortisol levels change when we're out in nature, the microbiome. So I love that. And as women, I think we intuitively know that we're connected to these cycles, but we don't have enough discussions about them, and we aren't taught that by our doctor, and we're definitely not taught that in our sex ed course class at 14 years old. But if you start to tap into the nature's rhythms, you'll see how, as a woman, you are so intimately connected with nature's rhythms.
Yeah, I love that. And to your point, if the woman still has her ovaries, we also want to just and she doesn't have the uterus, let's say, of course, we know that the ovaries are the things that produce the hormones, and the uterus is, the thickening of the endometrial lining and then the eventual shedding of it. So if she still has her ovaries, there's still going to be those hormones that are going to be produced, but there's going to be no endometrium, no endometrial lining to shed. So we want to be, and I don't think that was clear in the question. I'm not sure if she still has her cervix either, but I would say that the lunar cycle would be the best way to sort of just anchor yourself. So looking at the different phases of the moon, anchoring yourself to that. But also, if you do still have your ovaries, know that you can still have some of those like PMS type of symptoms. You can still run estrogen dominant or androgen dominant, let's say, depending on the activity of the balance or lack thereof of the hormones coming from the ovaries.
Yeah, I think that's super important. We even have a case in our fasting group where a woman had both her ovaries and her uterus taken out. Her doctor said, you're going to be in full menopause within 3 months. And a year later, she was still making hormones. And it went on for almost 2 to 3 years before she fully went into menopause. And he was shocked. But this got me thinking that when you pull an organ out, what we don't realize is you don't get all the tissue out. Like there can still be some of that tissue in there, and the outer part of the ovary, the thecal cells, those are making these hormones. So if you pull out the organ, doesn't mean that there's not a little bit of production that can still happen, especially with a clean lifestyle.
And let's talk a little bit about chronic stress. You've brought it up a couple times now. I think it's an important consideration when we're actually talking about estrogen dominance. And you are really a subject matter expert here. And I think that most of us, we like to discount, the physiological consequences of stress. Like what we think stress is like this red-faced, screaming, pulling their hair. That's like the stressed out person. When for women, of course, we have a very unique and separate stress response. Number one,
yes.
But number two, if my life is falling apart and you come to me and you say, "Hey, Steph, how are you?" What is the 99% of the time I'm going to say, "I'm fine. I'm great. How are you?" Even though in the background, things are just, it's all chaos. Chaotic. Right. Yeah. So
how many of us is that the case, right? It's chaos back there.
And we're all like,
I put makeup on, but what is it really looking like back there?
Right.
Absolutely. Let's talk about that because one of my favorite things to say is you cannot green smoothie your way out of chronic stress.
Yeah. And
you can't kale salad your way. And now I know I just touted all the benefits of green smoothies and kale salads. I recognize. And will they help you? 100%. But and will supplementation support you? Can you give back to your mitochondria because your mitochondria is actually the one that's making cortisol? Yes, you can absolutely take the alpha lipoic acid. You could take the acetyl L-carnitine. You can take the CoQ10. I can keep naming all the things that your mitochondria needs to function. But at the end of the day, if you're constantly in a state of triggering up the stress response system, you're going to constantly continue to keep depleting. Yeah. And we know that one of the biggest hormones involved, cortisol, is going to have a profound impact on so many other hormone systems inside of the body, including estrogen dominance. Absolutely. I think one of the things that a lot of us don't know is that we think about cortisol, we think about the survival hormone, which yes, it is. But then one of the number one jobs of cortisol is to regulate insulin. And when we have a situation where cortisol isn't working proper, like when it's overly, we're just firing it off over and over and over again, you are then firing off insulin over and over. So we're constantly crying wolf. And what we know, not to say that I'm not concerned about liver function and what happens with the liver and the gut when it comes to inflammation. But I always say that the number one hormone that women need to focus on when it comes to our 40s and beyond is insulin. Because insulin, we think about hemoglobin A1C as an inflammatory marker because of insulin resistance. And that is also showing us that insulin resistance leads to dementia or cardiovascular disease or cancer or, a number of different chronic conditions. And what a lot of us don't know is one of the biggest triggers for insulin resistance is going to be deregulated cortisol levels due to how we're managing stress in our stress response system on the daily. And what we don't recognize, I think, Stephanie, what you said is that anytime we find ourselves kind of like that, like we just get a text message or we're running late to a meeting or something's happening with our family or whatever that may be, the average woman can fire off the stress response system 25 to 50 times a day and just not even know it. And we talked about this. I in my 20s, I was addicted to stress. I leveraged it. I used to call stress my slide edge because that's when I felt that jolt of that little extra something that I could use to get through the rest of my day. And I just kept leveraging and buying against it until I had severe chronic fatigue. And so oftentimes a lot of us, we're mistaking what we think is that extra something, that little extra energy, that extra jolt that we just got. That's adrenaline, right? And what you just, in order for us to have harnessed that adrenaline, we had to fire off the stress response system, the HPA axis, the hypothalamic pituitary adrenal axis. And once we get into a habit of pushing that button, we trigger it more and more and more. And initially we can get away with it. We could potentially get away with it for a decade, maybe even 2 decades. And we can kind of brush off symptoms as, just every day. That's how women are. That's just the way things are for us. But eventually it's going to start to show up. It's going to start to show up in prediabetes. It may show up in an autoimmune condition, or often I see it usually shows up in chronic fatigue and burnout.
And I think that this is such an important topic to be having in light of lockdowns and the pandemic and the amount of stress. I mean, we've talked about this in previous podcasts, but women have disproportionately been affected by this pandemic. Not only are we talking about child abuse and domestic abuse, but many women, I think the December numbers, in the US came out as like 500,000 women left the workforce. And in January, it was like 275,000 women. It's like just astronomically abhorrent. And because they had to lockdowns, children, homeschooling. So there's been this, and I'm doing homeschooling.
And chronic conditions.
And then you layer it on top of like metabolic insufficiencies and metabolic syndrome and some of these potential, if she's sort of creeping towards the estrogen dominance, she has that progesterone that's lowering. And then you throw this like big whammy of a pandemic, you take away her ability to be financially, independent, and you add on all of this stress and this uncertainty, then all of a sudden you've just, thrown gas on a fire, and we start to see this absolute dysregulation, as you were saying, in the HPA axis. Mm-hmm. And you said something really, really interesting, and I just wanted to highlight it. So cortisol is technically a counter-regulatory hormone, meaning it's supposed to oppose insulin, right? But you said, 25, 50 times a day, we're getting these like shocks, like the adrenaline, the boss is bothering you, the child keeps interrupting you, which is like my case, like I'm trying to get work done every 5 minutes. Mommy, I need help with, so
something. It's always something.
Yeah. You're constantly being interrupted, train of thought is broken, etc. So what happens, metabolically and physiologically is cortisol is like, no insulin. No. We can't bring the glucose into the cell right now. We need to put them in the muscle so that we can fight or flight the terror, the impending threat.
Whatever threat that is, which is not a physical threat.
Right. It's usually you're sitting, your boss sends you an email that, augments your heart rate, your child interrupt, you're not running around, you're not running away from the bear. So as you said, they actually over time, they tend to actually go up and down together, because cortisol is like, hey, I need the blood glucose just in case. But insulin's like, listen, we're going to die if there's this much blood glucose in the thing. Like
they co-elevate.
They co-elevate. Exactly. Mm-hmm. So let's talk about let's sort of tie this in with insulin.
Solutions.
With some solutions, but also with insulin resistance, because I think that, for a perimenopausal woman, one of the things that we know is she often complains of like brain fog. There's energy and moodiness, as we've been talking about. And of course, when you're constantly firing off that adrenaline, now you're not making energy in the most efficient way. You actually move away from the mitochondria. So I just want to touch on that, and then we can get into insulin resistance, right? So the mitochondria, is the center, what we call oxidative phosphorylation. This is like, fancy word, just means most efficient way for our ATP to be being produced. But when you are, as you were saying, the cortisol, the adrenaline, the norepinephrine, these like these stressors, we now are moving into less efficient ways of making energy, which is why, Betty, you are feeling bagged at 2. It's why you reach for the coffee at 3, right? Or the fourth coffee or whatever it is at that time. So let's talk a little bit about how this constant elevation of cortisol can lead into insulin resistance, and just maybe explain, what insulin resistant, what it is, and its relationship to cortisol.
Mm-hmm. Absolutely. So again, when we have that situation where like you had pointed out, where our bodies, because our brain doesn't know the difference, right? I always talk, the core mode of operation for our bodies is essentially survival. Our body's always going to choose survival over anything else. Over reproduction, over digestion, over the immune system. Like, we know that if we're in a state of stress, our immune system shuts down for several hours because our body is having to reallocate resources to survival. Because our brain just has not caught up with the fact that now there is Instagram and there's everyday stressors and there's to-do lists and all the things. Like, your brain just keeps still thinking that there's some type of the really, really serious physical danger out there. And it does the best it can to address that. So when we get that stress response, we know that we're going to fire off the catecholamines of epinephrine and norepinephrine. Those are going to that's that adrenaline that you feel that like you could almost go do a little sprint in that moment. Then the next hormone that comes in is cortisol. It's that long standing, that's what creates the chronic stress over time. And when cortisol is released, like Stephanie said, it's designed to be, opposing. But over time, when we're constantly firing it, it ends up co-elevating insulin. And insulin basically is crying wolf to our cells. And eventually your cells are like, wait, nothing's happening. Why do I need to keep releasing, and so ultimately your cells and those receptor sites for insulin, which are on every cell in the body, begin to become resistant. They can't keep taking the hit because it creates inflammation in the body. And there's a lot of protective mechanisms in your body that says, okay, enough is enough. We're going to get in trouble here. And so when that happens, we know that unfortunately more glucose is in the bloodstream. We know that we start to see issues happen where we start to see inflammatory markers go up. And that's the biggest concern around insulin resistance, is that we start to create more inflammation in the body, where we start to see the belly fat, where we start to see the brain fog. We start to experience those cravings. We start to see a deregulation of estrogen and progesterone, because when I think about the hierarchy of our hormones, it's usually the metabolic hormones. It's going to be cortisol, it's going to be insulin, and it's going to be thyroid. Over time, we're going to see potentially a deregulation of our T3 and T4 hormones as well, our thyroid hormones. And ultimately what we begin to see over time, if we keep firing off the stress response system, is that we're just creating more and more and more inflammation. And that's where a lot of these symptoms are coming from.
Yeah. In this next video, Dr. Sarah Gottfried and I are talking about keto for women and why it is exquisitely different for us. We are talking in this next video about the testosterone advantage, cortisol, and the way that you can do keto right as a woman. Click over here and I'll see you there.
It's not a blanket statement that keto is good for everyone. I want to be sure that comes through loud and clear, because we have to personalize